Welcome to Skinside Out, where we uncover the science, trends, and truths behind skin health. Your trusted guide to the world of dermatology. This podcast is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional.
Welcome to Skinside Out, where science meets beauty. I'm your host, Dr. Zain, with Heather, Courtney, and Crystal. So today we're going to be continuing our conversation about complications in aesthetics. So let's dive right into it. So we're going to talk about injectables. So Heather, do you want to start?
Sure, yeah. So we'll kind of touch on just different types of complications you can get with injectables. So I think the most common one, or I guess most well-known, is intravascular occlusion. So meaning if we were to use a filler or an injectable product and we inject it into the blood vessel, it could occlude the blood vessel and block blood flow to that area. And there are some really serious areas where that could, lead to blindness, tissue necrosis. We've seen it a lot in the office, unfortunately. But the nice thing is there is a way to reverse it. So
in the office from other offices.
Yeah. Sorry, that's what I meant. Yeah. Coming to us from other places, having that complication. So unfortunately, we've seen it, multiple times from those practices. But the nice thing is we can use a product called Hylenex, which helps to kind of dissolve that filler and break up that occlusion.
It's important to know that it's not like, it's going to be definitely reversed, right? There's a time factor, right?
Yeah.
So if there is a significant amount of time that's gone by, the tissue's not getting oxygen, it can lead to permanent necrosis and other issues.
And typically it'll form as like this discoloration, whether it's like this blanching effect, so like a whiter appearance to the skin, or like even a grayish hue. It really kind of depends on how involved it is. But it could get bad pretty quickly, so.
Yeah, and then you can even get blindness, right?
Yep.
So if you're injecting in certain vessels that have circulation that feeds the, the blood supply to the eye, you can get blindness.
And that's a big thing because there's not a lot of pathways that supply blood to the eye. And so if you're blocking that, there's no way around getting blood to that area.
Yeah. So intravascular occlusion, definitely one of the scariest complications we see with filler. Any other injectable complications that we see?
I guess I wouldn't really call this a complication, more just like a side effect, but like bruising and swelling, those are pretty common. Yeah. Also using the wrong fillers in certain areas. So if you're using a very thick, viscous filler for somewhere that needs more movement, it's going to look funky. It's not going to move when your tissues want to move. I had a patient also too, just going into like lip fillers, for example. There are a lot of different lip fillers that you can get. Some give you a more subtle look and some give you a more like juicy, plumpy look. And this patient really wanted a very subtle, natural enhancement of her lips. And they gave her a product that is very well known for giving you that juiciness. And so she told me that she had that product and I was like, well, that's why, unfortunately. So I think really going to somebody who has that expertise and knows what filler should be used where, but also what product gives what result.
Yeah, and I've even seen issues where the wrong type of product was injected because some of these products look the same, right? So there was a practice that, I was observing, I think I was in training. The nurse handed over Kybella instead of Botox.
Stop.
Oh my God. Oh, I have a story too.
So not only was it crazy painful and swelling, but it actually caused a little bit of skin necrosis and ulceration. So, and then they realized what happened.
Very similar story. This didn't involve me at all, but a medical assistant had drawn up Candida instead of Botox. And so Candida is actually a yeast that we use to inject in warts, and that causes your immune system to respond and fight the virus off. So they injected her whole forehead with Candida, swelled up, got really red, very uncomfortable. Thankfully, she was okay, but it was, I think, a little bit of recovery on her end, too.
I witnessed that same thing, that it was mixed strong, and the patient immediately was like, oh my gosh, why is my forehead burning so badly? And, you know, they're like, I don't know what you're talking about.
Yeah, you're fine.
You're fine. Like, it's normal. But until later, they tested it on themselves, and she was like, okay, yeah, no, this is not mixed right.
That's crazy. I can't wrap my head around that. I believe it. But I just, knowing it myself, I'm like, that's crazy.
Yeah.
Yeah, I know mistakes happen.
Yeah.
But that's
Those
why
are
it's
big
so
mistakes.
important.
Yeah, it is a big
I
mistake.
know.
Especially the Kybella. I mean,
Oh, imagine that.
no. As someone that got
I would've lost
Kybella
my
in her
needle.
jaw, like that was good.
Any other complications that you see with injectables?
Tox, fortunately, it does wear off, but like we see from time to time injectors who are placing it like
Too
incorrect.
superficially.
Yeah, or, you know, either you get the spot guy or you're dropping the brows,
Ptosis.
and so it's all about placement. Or same thing with the lip flip, where they're placing it might bring your lip out this way instead of that way. I mean, it's just wrong placement, I think, in general.
Yeah, so that goes, along with training, technique, education,
And knowing the anatomy.
Yes. I mean, those weekend courses or half-day courses, they don't cut it.
Yeah.
No, well, and by the way, for those weekend courses, they choose easy models because you are training.
And they also dilute the products, too.
Yeah.
So you're getting, I think you get a little bit of that, I guess, experience injecting, but you're not feeling how those products are actually injected because they're diluted.
Right.
So, I mean, those are, the complications that we unfortunately see in real life. And they are real complications, and not all of them are reversible. And, once they cause permanent destruction, you can have scars that are very difficult to treat. And you end up spending a lot more kind of correcting the complications than you did trying to save a few bucks, going to somewhere that was less reputable.
I guess we talked mostly about filler for injectables, but there's also a lot of other complications with neurotoxins that I don't think we really touched on. But just like similar kind of thing, if you inject into the wrong place, it could lead to like a lid lag, or it could drop your brow and stuff like that.
Yeah.
So definitely knowing that anatomy and knowing where the muscles are.
Yeah. And then also like making sure that you're reviewing the patient's medical chart and allergies, because there are certain neurotoxins, like if you have a cow's milk protein allergy or albumin, like there's some of them that have albumin and other proteins that can cross-react, and you can develop a reaction. And that's always something that you want to avoid, especially if it's something preventable and you looked at their history.
Autoimmune conditions is another big one. I think, a lot of times there can be practices that kind of skip over that, and I think it's important to know as a injector.
I mean, cosmetic treatments are medical treatments, so people tend to like poo-poo them, like, oh, it's just like I'm going to look good, and it's just a very low risk procedure, but they are medical procedures at the end of the day, and there are true risk and ramifications for things that go wrong.
Yeah.
We obviously see a lot of injectables. We see a lot of lasers and energy-based devices. Courtney, what have you seen as common complications?
So I feel like laser hair removal, reduction, and IPL tend to be the biggest, offenders. I think, as we've mentioned before, with there being so many different settings that you can use on the laser, so many different type of wavelengths, different skin types that you're seeing, that, getting that history on the patient. Okay, have you been out tanning the last, 6 weeks? For example, with the laser hair, I can't tell you how many leg burns I've seen. You should know in the summer, no one is completely sun-free. Like at this point, I kind of joke about it, but I do not treat legs in the summer. I refuse. I have just seen so many burns with the laser, and they will look like these little circular, sometimes half moon. Or what I've also seen, which no one is perfect. I know my overlaps are not perfect either, but you'll see these like pictures of these burns that are like spaced apart like 4 inches. So even if they didn't get burned, they still are missing like gaps of skin for the hair. So I think those are the biggest offenders. And, with the IPL, again, it's not a device that's safe for all skin types. So, I had a esthetician one time refer a patient to me who was Hispanic, and, she was very upset that I would not do the IPL on her that day. But she understood when I told her that the risk of burning her was incredibly high, and I hated to be the messenger, but let's get you back for something else.
But there are places that will happily treat that.
Yes, I almost got a CO2 laser one time, and then before learning that it wasn't meant for my Fitzpatrick.
Well, I just had a patient last week. I saw a sweet young girl. She, has really bad rosacea. First of all, she was like, I don't know if I have rosacea because I am Hispanic and Latin, and I said, well, it's definitely rosacea. And then, she said that this other place in the area had recommended IPL for her. And I said, girl, no, and she said her gut feeling it wasn't right. She went home, good, smart girl. She Googled it. Can I do IPL with my skin type as this? It said not recommended. She came to see us and we talked about the YAG, but you just, there is such a high risk of burning someone if you don't know that skin type and you're not experienced with that device.
I think the most common lawsuit in dermatology is from lasers.
Yeah,
Agreed.
Laser hair removal specifically. That's the highest in any procedure in aesthetics.
And a lot of people think, it's such an easy procedure. Anybody
Looks
can do
easy.
It looks easy. There's science behind it. There's reasons why there's so many different devices, and unfortunately, some offices don't offer the right devices for all the skin of color patients that they have, and they just don't want to turn away business.
But then that's where you get, as mentioned before, that undertreating, because they would rather undertreat and continue to take that money than accidentally burn someone. So you have these techs that have no training, and they're like, oh, well, I'm just going to use the preset settings, the lowest setting possible, and just keep going. And then people, as another complication, can get this paradoxal hypertrichosis where they're actually having increased hair growth, and that's not what you
Those
want.
patients are so mad. Like, you have this lady trying to treat her facial hair, and she's growing a beard.
Yeah.
A thicker beard.
So it's that's why settings are so important. Training is so important with the lasers.
What about energy-based devices? Have we seen any complications specifically with radiofrequency microneedling?
Depending on the device and depending on the depth that you're using, you can see some fat loss in areas that you might not want that. So like the cheeks, we want that volume to stay in our cheeks. So if you're using a depth that is not appropriate for that area, it could cause that fat to almost atrophy, and then you're left needing filler to fill that area. So you're just creating exactly.
And specifically with the Morpheus 8 device, I've been hearing a lot of issues with patients being previously treated. And that used to be the hottest device on the market.
Yeah.
Everyone needed to have
Morpheus.
it. Do you guys have Morpheus 8? No. Like, I'm not coming here.
Yeah.
I'm like, okay. But yeah, Morpheus 8, I know they've had their challenges because they're very aggressive treatments and can cause that fat loss like you were talking about. And people are looking worse than when they had prior to having the procedure. So
even traditional microneedling, I've seen people who have those like tear marks. So like almost like the needles were dragged across the skin rather than, use it. Yeah, it almost looks like there was no glide, that someone just like dragged this device across it. I mean, there's lines and everything. And so I've seen that before. People who do microneedling and go too deep in the skin, and the pressure that they're using, because some people use like a stamp method where instead of actually creating a glide and circling in their motions, they will stamp. But what happens is they stamp too hard, and then you get that risk of
That's
scarring.
how the Morpheus 8 is the stamping.
Yep.
So.
Yeah.
So, another thing that this kind of brings to mind is how important pre and post procedure, how important it is to have protocols so that patients get optimal results and not have complications. So like, for instance, like patients who are getting chemical peels or certain lasers, especially those that have hyperpigmentation or skin of color, sometimes I pre-treat with brightening agents such as hydroquinone and other like tretinoin to help reduce the chances of you getting hyperpigmentation. And then post-procedure, being really focus on sun protection, when to start incorporating active ingredients for your skincare, and just making sure that the patients understand. And, for ablative treatments or like really aggressive treatments, I often have prophylaxis for, viral, fungal, and bacterial infections so that my patients don't encounter any of those issues post-procedure, because those are terrible because your skin's open and you get those infections. It can cause more issues like scarring and, other issues.
Yeah. My mom actually had CO2 completed by Dr. Zain last year, and her aftercare was set up very, very well, and she did phenomenally. But at the same time, my best friend's mom was having CO2 completed somewhere else, and they told her to just let the skin dry out. Don't do anything. Don't put anything on it. Face, neck, and kind of chest area. And it's awful to hear that, because she had pink scars in that area for months afterwards, because she was just doing what they told her to do, and she thought their expertise and their knowledge was what she should go by.
How did she end up doing?
I think she's fine now. I haven't seen a picture of her recently, but I think she still had some like leftover, like you could see the square of the device stamped on her chest.
Yeah.
So I think after her daughter sent me a picture, I was like, why is she not putting anything on? I think at that point she was probably post day 4 or 5. So I think she started putting stuff on after that.
And it's so critical to be on the proper protocol early on, because it really helps with the results and facilitates healing.
Yeah.
By not following those protocols, you can like drag this out like 4 times longer.
Yeah.
And also have risk of hyperpigmentation and other issues that it's kind of not needed.
Yeah.
So we talked about lasers, energy-based devices. Anything else that you can, you typically see as complications?
I think we briefly touched on like post-chemical peels, like the biggest thing being hyperpigmentation, especially for people who are more sensitive to that, or skin of color.
Well, just going off of like peels too, I think like Dr. Zain had mentioned, prepping people for peels. Like, I've worked with some providers that don't believe in hydroquinone. They think it's like the devil's work. It blows my mind. So it's funny when like patients will come to me and be like, oh, well, I don't know that I want to use hydroquinone. They get so nervous about it. And I'm like, this is our safety net. Like it makes me feel more comfortable. It will make you feel more comfortable. It will, better the outcome of your peel. So by suppressing that pigment in the skin, you will limit that risk of hyperpigmentation after the peel. Things like steroids, I know sometimes we'll utilize too for post-peel, just to optimize the results and again, help with that post-inflammatory hyperpigmentation, especially in people with skin of color. So I think those are all, important adjuncts to your treatment to minimize those complications.
Yeah. And I want to kind of talk about how complications can happen to anyone, even the most experienced injector. So I am not saying that it's not going to happen to me. It's bound to happen at some point, but it's how you treat the complications and having that ability to do that in real time, because time really equals your skin health at that point. If you wait and delay treatment, you can have poor outcomes. So that's why you can maybe do the procedure, but if you don't know how to treat the complications, you have no business doing it.
I'm so glad you mentioned that, because very early on when I first started doing glycolic peels, which glycolic peels are pretty minimal, there are people that can have reactions to them. I think that's why it's important to start low. I'm always going to start at a lower percent, but with this patient, it was probably in my first few months of doing aesthetics, and she had a wedding coming up, so she just wanted to do like a light peel, and she'd never had one before, so I said, okay, we're gonna do a 20%. That's as low as we go. And she had a wedding in like 3 weeks. So again, a normal turnaround on a glycolic peel is about 48 hours. So ample time, but she had a true allergy to the glycolic, not a burn, not a true allergy. So she calls me and her face is red, swollen, itchy. And I freak out because I'm like, okay, this is my fault. I burned her on a 20%. Like, what did I do wrong? And anyways, my doctor ended up putting her on prednisone, especially being so close to the wedding to make sure she was fine. At the end of it, she she comes back after her wedding and she's like, that was the best my skin has ever looked because of the collagen production from the inflammation, and then the prednisone cleared her acne. So she literally looked so good, and she's like, we should try that again. I said, no, we're not. That gave me a heart attack. I was up for like 2 weeks straight. Like, did I mess her up?
The other thing I was going to add, just going off of that, is with injectables, just with that intravascular occlusion, I think, yes, it is a very serious reaction or complication, and it unfortunately is very common. But I think a lot of people do say, you know, if you haven't had a vascular occlusion, you're not injecting enough. And you could aspirate all day long, and that's a technique that we use to kind of pull back on the syringe to see if we're in a blood vessel. But there's always the chance that you're in a blood vessel and you don't know it. So I think, thankfully, we have never experienced that in our practice, but I think it is very common and something to be mindful of.
Yeah. I mean, I have aspirated blood before, so clearly I was in a blood vessel. And obviously I, redirected and, everything was fine, but that's always scary, seeing that flash of blood.
Yeah, I have too.
So very scary, but it's humbling. And for patients who, have heard, a cannula is so much safer than a needle. Yes, it is safer, but the risk is not zero to get an intravascular occlusion. You can still get into a blood vessel with a blunt tip cannula. And that's scary.
Yeah.
But it can happen. But I do find that I am more confident in that I'm not going to be in a blood vessel if I used a cannula versus a sharp needle.
Yeah.
But I don't by any means think that the risk is zero. And even with aspiration, like people say, aspiration. They've shown that it doesn't always reliably indicate whether you're in a blood vessel. It's also the gauge of the needle, how much pressure you're using and everything there. And you have to wait.
For like 10 seconds.
Yeah, nobody's waiting 10 seconds. Yeah. I think in reality. So let's be real here. Are people really getting a false sense of security by going to these trainings and like, oh, we should aspirate. And, if you don't see that blood flash, you're good and inject away.
Yeah,
so,
it's not always 100%.
Yeah, and if you have questions, I feel like it's always better to ask your provider, if on the other end of things, okay, even though maybe it looks like bruising, because again, that vascular occlusion can come off on that dusky kind of purplish or gray color. And sometimes people can confuse, at home, they might confuse that with bruising or, so I think it's always a good idea to reach out to your injector and just make sure, hey, is this normal? Again, they're not going to be bothered by you. They'd rather know about any potential complications ahead of time.
And oftentimes with vascular occlusions, they're painful. The patients are complaining about pain. And when I'm examining them, you typically don't see that capillary refill with pressure. So that's another sign. So when a patient calls and they say, hey, I think something's wrong, and they just had filler, I have them come back in the office just to make sure. And, all the times that I've been called, they've been luckily bruises. And patients are just scared. And sometimes they have hematomas and an enlarging bruise. I feel so much better seeing them in person. Otherwise, I can't sleep at night.
Yeah.
I can't. I'm thinking about them. Hey, I need to see you. I've gone back after hours. Hey, patient meets me at the office. I'm taking a look. I don't care. I'd rather them be safe and not suffer a complication.
Yeah.
Because again, time is of the essence with something like that. So.
Yeah. And there are also those devices with infrared light that you can kind of see the vasculature. Have you seen those, the vein lights?
Yeah.
So that's another thing. People, I'm using that. That means I'm not going to get to a blood vessel. Yeah, you can dodge some blood vessels so you don't get some bruising, but still, there are so many little branches of those blood vessels. So,
there's never a 100%.
Never say never.
And too, I think technique, a lot of times we do this retrograde technique where we may aspirate and see, okay, I'm not in a blood vessel, I'm good. But as you start to pull the syringe out, that's a technique that we use. You could be passing through a blood vessel as you're coming out. So you never know.
Yeah. That's why it's so important to respect the skin. It's an organ. It's our largest organ. It is very complex, and the face is super complex. I remember during head and neck anatomy as a first-year med student, it was crazy. All the different structures that we had to learn. My little brother's an ENT surgeon. I still don't understand how he does what he does, but it's very humbling and it's scary. So knowing the anatomy cold is very important, but I'm still scared sometimes. And knowing what planes to inject, where you find those structures. And the scary thing is, we learn about this angular artery, right? But there was a paper that showed that there are 4 different variations anatomical. It can be very different than where you expect it to be. So there are anatomical variations in mankind, and you need to be able to respect that. And not everyone is the same.
Yeah.
Yeah. So we talked about chemical peels, we talked about devices, laser-based, as well as energy-based, and we talked about injectables. So I kind of wanted to segue and kind of talk to Crystal. She was a manager at a medical spa, and, some of the, complications that you saw.
So one of the complications that I saw, which I had mentioned before, was the laser. We had someone come in for a laser treatment, and her face ended up getting burnt. And upon looking and investigating it, we found out that the person that did the treatment on her skin wasn't actually licensed. I've seen only one vascular inclusion, and it was very scary. You had to work really quickly. So thankfully I haven't seen too much, but definitely being able to know what you're doing and how to handle it is very, very important.
I mean, I don't want to scare everyone in getting cosmetic treatments. They can be done very safely and reliably. I think it just requires some research on your part, making sure that whoever's treating you has the correct qualifications and training, and they also understand how to treat complications. And it's really hard to know that without, doing some digging on your provider, seeing what they've been trained in. And I do think that it's worth the extra time to do your due diligence. And that's why I feel confident in providing great care in my office. And, I have Courtney and Heather who can help me treat my patients as well. But, things can go awry, and it can happen even in the most experienced hands. So us being able to manage any complication that come forward, that's just as important as being able to do the procedure. It was a sobering discussion, a little scary, but I think it's an important discussion and something that we're seeing more and more of as aesthetics is continuing to rise. But, I think that we'll have other discussions in the future as more, aesthetic advancements come about, and we learn, more, issues that come out with new technologies, new, treatment options. So, stay tuned. This is an evolving science, but we'll be hopefully giving you some updates as we go along. So this wraps up our episode. Hopefully you liked it. Hopefully, you found it insightful. Please follow us, like us, and until next time, Skinside Out.
Thanks for listening. This episode of Skinside Out is complete. If you enjoyed today's episode, don't forget to subscribe, rate, and leave a review wherever you listen to your podcasts. For more tips, updates, and behind-the-scenes content, be sure to see what fun we're up to on TikTok. Follow us on Instagram and Facebook at Nor Dermatology and Aesthetics. Check us out online at norderm.com. Discover why our patients give us 5 stars on Google. Call us today at 919-617-0717.